Hello everyone, welcome to my channel. So in this particular session, I'll be discussing the quiz which I have posted on 1st of May on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. So every day I'm posting quiz on my Telegram channel, and on the subsequent day I'm also posting the explanation in the form of the screen recording. So in this particular session, the first question is, all of the following are the components of the 𝐬𝐻𝐫𝐞 syndrome, the except. The options are dysgraphia, 𝗂𝐽𝐽𝐺𝐴, finger agnosia, stereognosis. So this particular question of 𝐬𝐻𝐫𝐞 syndrome is a very important question which has been asked previously many a times in many of the entrance exams. So if you want to remember this components of the 𝐬𝐻𝐫𝐞 syndrome, I'll just give you one mnemonic, right? So the mnemonic is that we have a accountant, he is a bad accountant and he can't do taxes. Now, what all he has is, he has 𝗂𝐽𝐽𝐺𝐴, right, where he can't calculate on a calculator. Next, he also has agraphia, that is, he can't write out the calculations either. And he has finger agnosia, he even can't even count on his fingers. And he also has right to left disorientation, so he is so confused he can't do his job. So what are the components of the 𝐬𝐻𝐫𝐞 syndrome now? It is the 𝗂𝐽𝐽𝐺𝐴, agraphia, finger agnosia, and as well as the right and left disorientation. And along with that, we have one more component, that is the alexia. So alexia is what, where the individual is has inability to recognize or read the written words, right? He is having the inability to recognize or read the written words or letters. That is what is called as the alexia. And one more important question related to 𝐬𝐻𝐫𝐞 syndrome is that, where is the site of lesion? The site of lesion for the development of the 𝐬𝐻𝐫𝐞 syndrome is in the left parietal lobe, in the region of the angular gyrus. And what is the vessel which is affected for the development of the 𝐬𝐻𝐫𝐞 syndrome is, it is the middle cerebral artery. Now, going back to the question. So all of the following are the components of the 𝐬𝐻𝐫𝐞 syndrome except dysgraphia, 𝗂𝐽𝐽𝐺𝐴, finger agnosia, stereognosis. So stereognosis, it is not the part of the 𝐬𝐻𝐫𝐞 syndrome, right? Then followed by that, you see the next question. Lesion of the left temporal lobe produces all of the following except. The options are aphasia, quadrantanopia, anterograde amnesia, then apraxia. So what all will be the features of the left temporal lobe lesion? Aphasia will be seen. Why? Because the left temporal lobe is a dominant lobe for the speech, where you have the presence of the Wernicke's area, right? And once this left temporal lobe is gone, the individual develops what type of aphasia? That is, the individual develops what is called as the Wernicke's aphasia. And there will be also quadrantanopia, and there will be also development of anterograde amnesia. But remember, apraxia is not the feature of the left temporal lobe lesion. Very important point, right? Next question. That is, Hunt and Hess scale is used for grading of subarachnoid hemorrhage, intracranial hemorrhage, subdural hemorrhage, extradural hemorrhage. So the answer to this question is the subdural hemorrhage. Now, what exactly is the Hunt and Hess scale? It is used for, right? It is used for grading of the subarachnoid hemorrhage, right? It is used for grading of the subarachnoid hemorrhage. Now we have totally 5 grades in this, right? Grade 1, 2, 3, 4 and 5. Now you take grade 1. Grade 1 is that the individual is mostly asymptomatic, or they'll have mild headache and the rigidity will be there, that is minimal or slight nuchal rigidity will be there. Grade 2 is that there is moderate to severe headache, whereas the neurological deficit, if you see, they will have no neurological deficit except for cranial nerve palsy. Along with that, there is also nuchal rigidity. Grade 3 is that where there will be drowsiness or confusion, and there will be mild focal neurological deficit. And grade 4, the individual will be in a state of stupor, and here there will be a gross neurological deficit, and that is in the form of the hemiparesis. Grade 5 is that the individual will be in a state of coma, and there will be abnormal posturing, that is decerebrate posturing will be there. So this is what is your Hunt and Hess scale of the subarachnoid hemorrhage, right? Where we have totally 5 grades. Next question is, 3H therapy for treatment of subarachnoid hemorrhage consists of all of the following except. The options are hypertension, hemodilution, hypervolemia, hyponatremia. So what are those 3H therapy for the treatment of subarachnoid hemorrhages? Hypertension, hemodilution, hypervolemia. But remember, hyponatremia is not the part of the 3H therapy for treatment of subarachnoid hemorrhage. Now you take this hypertension. Now what happens in patients with subarachnoid hemorrhage is there will be compensatory vasospasm. Right? There will be compensatory vasospasm. Right? Why there is compensatory vasospasm? In order to prevent further hemorrhage, the cerebral blood vessels, they undergo vasospasm, that is narrowing of the cerebral blood vessels. And because of that, that will lead to the ischemia, which will precipitate the underlying clinical condition of the patient. So there will be further neurological damage. So now, what will be helpful to counter this vasospasm is the hypertension. Okay, so hypertension can help to counter this by increasing the blood flow to the affected areas. Okay, so keeping the blood pressure slightly on the higher side is good in patients with subarachnoid hemorrhage. Then coming to hemodilution, right? Hemodilution refers to reduction in the concentration of the RBC in the blood. And how is this hemodilution achieved? This hemodilution is achieved by supplementing the IV fluids, right? Or the blood products. Okay, so this IV fluids, what they do is they reduce the risk of the blood clots, right? They reduce the risk of the blood clots. Okay, that is why your hemodilution is very much important. Next is hypervolemia. So hypervolemia, it is another component of your 3H therapy. This is typically achieved through administration of the same IV fluids or the blood products. And by giving IV fluids, what we can improve is we can improve the cerebral perfusion, right? That is the importance of supplementation of the IV fluids, that is hypervolemia. So these are the 3H therapy for treatment of subarachnoid hemorrhage, but hyponatremia is not the part of it. Next question, that is, risk of stroke after transient ischemic attack is high in first 3 days, in first 2 days, in first 7 days, in first 14 days. Very important question. Remember, the risk of stroke is very high within the first 2 days of the transient ischemic attack. So these are the 5 questions of the quiz. So do subscribe my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba, for everyday quiz discussion. And you can join or you can subscribe to my Instagram handle Rajesh Gubba for everyday medicine updates. Thank you very much. See you tomorrow again.